painful is the hair transplant?
Pain in hair transplant generally happens.
How long do the results of hair transplants last? What is the success rate of hair transplant surgery?
No medical procedure is always 100% successful.
Please tell me, is there any side effect of hair transplant?
Asked you to believe on what they said. So
What is the cost of hair transplant? So how do you go about this question?
mostly it depends on a
Hi everyone. Welcome to Saraswat Hospital podcast. हम सब बहुत सुनते रहते हैं हेयर ट्रांसप्लांट के बारे में. सो पीपल नाउ हैव इमेंस क्यूरियोसिटी. हेयर ट्रांसप्लांट कैसे होगा? क्या हम करा सकते हैं? फीमेल्स में हो सकता है क्या? व्हाट इज़ द कॉस्ट ऑफ हेयर ट्रांसप्लांट? So many questions we have in our mind that sometimes we are overwhelmed by it. We want somebody, some very renowned person, some very experienced person, somebody we can count on to answer all our questions. Fortunately for us, we have today with us Dr. Satya Saraswat. He is an American board certified hair transplant surgeon. He has been awarded a gold medal in plastic and cosmetic surgery DNB by the then Health Minister of India, Mr. Ambumani Ramadas, in 2008, and has been giving his services in the field of hair transplant and plastic and cosmetic surgery for past more than 2.5 decades, if I'm not wrong. Yes. So welcome to the show, sir. Today I want to start with what is the success rate of hair transplant surgery?
So as we know, no medical procedure is always 100% successful. So what we have to look is for the kind of routine results a clinic is giving. But we have now seen with a lot of data coming about hair transplant and a lot of international conferences being organized that clinics are now sharing their failures also. If a clinic having a good reputed doctors, standardized protocol, at times they can also have a setback, there can be a failure also, and probably this is due to some newer conditions which we are knowing about, like FAPD, frontal fibrosing alopecia in pattern distribution, or alopecia areata incognita. These are the diseases which appear like a male pattern baldness but are having some other problem like autoimmune disorder where the roots are not able to take up, or the growth is suboptimal because of some other autoimmune factor where our body is themselves not allowing the transplanted hairs to grow. So it would be safe to say that the success rate of hair transplant is around 95 to 97%, but never 100%. There is no clinic in the world giving 100% results consistently in each and every case. So that would be a safe guess to assume.
Right. So another important question which people come and ask is, Doctor, I want to go for a hair transplant, but please tell me, is there any side effect of hair transplant? So what should we answer them?
Yeah, so again, the same thing that any medical procedure can have some side effect, but some minor side effects like itching, swelling, redness, things like that, they are very common, happens in 5 to 10% of the cases. Self-limiting, that means it will subside in a couple of days or so and nothing to worry about. There are rare side effects also, or dangerous side effects also. With more and more data coming, we are seeing that there have been rarely deaths reported after hair transplant, or a case where the patient lost his vision. We saw it in the newspaper. This happened somewhere else. So all the safety protocols, if followed during a hair transplant is a very rewarding and very safe surgery. But very rarely there can be some allergic issues or some other problems. By allergy, I mean the allergy to the medicines which are being given, or if you have some medical problems which are not controlled, like diabetes or blood pressure, or having some blood thinners and things like that, then there are chances of some side effect. In a good clinic, they will always have a detailed form for you to fill where they ask you about your medical conditions and medical problem. They get your blood test done in detail, not missing out on anything, so that when all these basic things are taken care, hair transplant is quite safe. But yes, there are side effects reported, and but in general it's a very safe procedure.
Yeah, so the take home message we can say is that in general it's a very safe surgery when all the precautions are being taken and you are in a good center with good people, good team, and you are taken good care of. Right. So another question this leads to is, what is the best age for hair transplant? Like, who can undergo hair transplant?
Yeah, it's a very important question, because today only we got a query from a person who was 19 years old wanting to undergo a hair transplant. So it's a consensus that unless we know where you are heading with your hair loss, we should not do the hair transplant. That's why it is not to be considered if you're quite young. By quite young, I mean absolutely contraindicated before 21 years of age. You should never go for hair transplant before 21, and you can go below 25 also if we know your family history of hereditary history of hair loss, and we know where in which way you are leading. Initially, do not think that the hair transplant is the first solution for a hair loss problem. Initially, you should take medical treatment and consult a doctor, and even that doctor should be, you should be visiting or consulting them over a period of time. And if your hair loss is responding to medical treatment, that means you may be a good candidate. Because the problem is, if you are, say, grade 2, Norwood grade 2 male pattern baldness, having the recession of the hairline on the sides, you want to go for a filling of this by doing a hair transplant. Later on, if you do not respond to medical treatment, or if you are not very keen on taking medical treatment, as we know many patients do not want to take long-term medical treatment. Suppose a patient having grade 2 male pattern baldness gets a hair transplant here, later on loses his remaining hairs, he will have this area filled up and this area empty. And now we are seeing such kind of patients who underwent a hair transplant very early in age, and a lot of grafts were used for the non-critical areas, and then the critical areas like this, they became bald over a period of
So
time.
hair transplant is not something we should jump
upon at the earliest opportunity, and avoid it before 21 years of age, and then let your hair loss be stabilized, and then plan out your hair transplant after discussing with your doctor.
So I remember just there was a case being discussed in one of our forums. They were discussing that there was this guy who was 18 years of age, but he was so much psychologically disturbed by his hair loss that he had suicidal tendencies. So he was an exception.
Those are the exceptions.
Yes. So in general, we should avoid early age hair transplants.
Absolutely. Yes.
Thank you. Then again, there are 2-3 more kind of people who need to ask whether women can undergo hair transplant, or if somebody has curly hair, whether they can undergo hair transplant. Can they?
Yeah, why not? Women can also undergo hair transplant, and it's good. The results are good if you're going for a hairline lowering kind of hair transplant in females. But if you have a generalized thinning, then a detailed consultation including all your blood work to find out the reason, whether you're having a female pattern hair loss, what kind of donor site you have. In general, hair transplant is technically more challenging and difficult to do it in females, because we can't trim the hairs completely, we can't shave them. We have to use some substances like adrenaline in a minimal quantity, because they can lead to a lot of shedding of the hairs or telogen effluvium post-procedure. It is possible, but technically more difficult to perform a hair transplant in females, and we have to find out the root cause of the hair loss in females first. As far as curly hairs, it's a very routine procedure being performed in curly hairs. The problem is when the hairs or the roots inside the skin are also curly.
So we know about the curly hairs and which are seen outside, but the problem is when there's curl inside.
Yeah. So we have seen a lot of patients who have a curl inside the scalp.
Yes.
Especially in the Afro-American or African patients. Yes. I mean, a lot of curl inside the hair, and then for that we need a special kind of punches, like trumpet punches, or we have special maneuvers like J maneuver or U maneuver. More difficult, but the positive thing is that when they are curly and when they grow up, they cover a lot of area. So with a minimum density also in a curly hair, you can get a better results as compared to the ones who have straight hairs.
So the scalp show is minimum due to the curl of the hair. The
Exactly.
same number of hairs, if they are curled, they give a better
results.
result than they. And viewers who need to know more about the female hair transplant, whether hair transplant can be done in women or not, how good it is, what else is to be seen, we have a very good video. You can click on the iCard above and you can see that. Yeah. So Dr. Satya, how long does it take to recover from a hair transplant surgery?
So recovery in hair transplant is quite quick, and it varies from person to person. We have seen that there are patients who heal completely, the donor side heals completely within a day or two, and then there are some on the other side who may take like 3 to 5 days for the things to heal. So sometimes there is some swelling on the forehead which can come to the eyes, and it can sort of, the eyes can become swollen, and then that again is a self-limiting kind of thing.
So sometimes people ask, doctor, how much leave should I take from the office?
Yeah. So it varies, but if I have to say a number, that maximum how much time it's going to take for you to heal or recover, I would say like 5 to 7 days. But sometime in majority of patient, it generally takes 3 to 5 days when you can start doing your work with wearing a cap or things like that, back to your own work.
So this brings us to an important question which people ask, doctor, how painful is the hair transplant?
Yeah, so pain in hair transplant generally happens when we are giving local anesthesia. And that can also be minimized if we are using very fine gauge needle, and if we are using vibration devices to give that local anesthesia, numbing devices. So now there are a lot of cool tip vibration devices also, which minimize the pain, stimulates your cold receptors, and at the same time, vibratory receptors are also stimulated. That way, even that pinprick is minimum. I would say the kind of pain you feel during giving the local anesthesia would match your pain which you get either making the tattoos or if you have got a PRP done, so similar kind of pain. But once that is done, and if it is given properly, the local anesthesia is given, then it becomes a totally painless procedure. Post procedure, we generally start with the painkillers for 3 to 5 days, and generally patients, I would say 99% of our patients generally say that the pain, they have no pain, and they were scared about it unnecessarily. But 1 to 2% cases, people having very sensitive scalps, they have some long lasting, like I would say like couple of days to a week or even 10 days, they can have some pain, especially in the donor area.
So unless the pain threshold of the patient is very low, usually it's a painless procedure.
Yeah, so pain is also very subjective. We have had a lot of patients who went on sleeping even while we are giving the local anesthesia.
Right.
They were totally unperturbed, and there was some who just, even at the thought of needle, start getting that pain sensation. Yeah. So it's very subjective, yes.
Right. So this brings us to one more question. So what do you think, like how long do the results of hair transplants last?
Results of hair transplant would last for as long as whatever happens to the donor hairs, whatever is the life of the donor hair, quality of the donor hair, the same thing is translated to the recipient site also. So if your donor hairs are going to last for a very long time, the results also last. But we have to know that even with age, the donor site hair also become thin a bit. Only important point is that when a doctor is doing a hair transplant, they should allow not to breach the safe donor area limit, although it's not a entirely demarcated line. It's not a clear-cut line. So there are chances that there may be some transgressions of safe donor area, which is common. But in general, it should not be sort of without assessment trying to take out whatever is
completely
there.
off limits.
Exactly. Yes.
So we have to see for the safe donor area for a long-lasting result. I wanted to ask another question here. We all know there are different methods of hair transplant, FUE, FUT, but are there any newer, better technologies for hair transplant? Some new equipment, some new instruments, something new in the field?
A lot of advancements are happening in the field of hair transplant as we talk. FUT was sort of a king or the gold standard till almost 2010. After 2010, FUE came, as we all know. Then there are specific advancements in the particular step. Like there are lot of machines now who are using different kind of punches, rotatory or oscillatory methods for the graft extraction, and there are improvements in equipments in the field of slit making. Previously, most of the doctors are using wide bore needles. Then they shifted to CTS blades, and now we are seeing Sapphire devices. And similarly, during the insertion step, previously it was done with the help of forceps, and now in that field we have implanters, and a lot of implanters are there, Choi implanter and other ones, and now we have in-root implanters in which we can transplant 10 roots even in a single go. So a lot of improvements are happening in the field of hair transplant as well as other
So,
fields.
doctor, how do you think implanter has an upper edge over forceps?
Definitely, implanter have upper edge because there is minimum sort of handling of the grafts while doing the implantation. It's more with the implanter, with the jeweler forceps, and less with the implanter. So minimum handling leads to better results with the roots, as they are very sensitive structures.
Right.
Also, it depends on the kind of trichoscopy reports. If a patient has a good amount of terminal hairs, then even the jeweler forceps will give as good results as implanter. But if you have sort of thinner, weaker hairs, I think implanters have some edge in those cases.
So I want to ask you now that suppose I want to get a hair transplant done. So what should be those things I should look for in a clinic, from where I should get it done? What are those points which I must see before I get my procedure done?
Okay, so most of our queries, they come online, and online also most of the patients can see. The first thing they have to look out is the qualifications of the doctor.
Yes.
Please do not go to a clinic where the degree or of the doctor or the qualifications are not mentioned, and then
Sometimes even the name of the doctor is not
not
mentioned.
there. Yeah, so this is very important. Also, kindly look out for the accreditations. So there are genuine accreditation bodies or organizations or societies which are doing a great amount of work in the field of spreading the scientific knowledge, like ISHRS, our parent body, International Society of Hair Restoration Surgery. Then ABHRS is one of the toughest and the highest accreditation body world over, and their standards are set so high that hardly a few American board certified hair transplant surgeons are coming out every year, and it's a rigorous screening process which for the doctors who can apply, and then they have a rigorous theory, practical, and there is a special re-accreditation policy in few years. Every few years, like around a decade or so, you have to appear in those exams, and they just don't look at your knowledge; they look at your ethics also, and a lot of other factors.
So doctors who are ABHRS they are very good in their field.
So yeah, it's a well-known fact, and
Yes.
ISHRS, and do look out for the qualifications. So a lot of people are doing hair transplant who should not be doing, whose primary training has not been in that field, totally unrelated field, and people are doing hair transplant. So this is qualifications and accreditation is the first thing. Second thing is the planning. How scientifically the planning has been made in your case when you go for the consultation. Did they do the trichoscopy to look out your terminal or vellus hairs? Did they do the calculation of your donor area, measured it accurately or not, or just looked at your scalp and said 2,500, 3,000, grafts?
So scientific
those
long-term
are
planning.
those are the red flags, but it has to be, and yes, exactly. And the planning, long-term planning, whether you should be taking medical treatment, how long, these are the important point. A very important point, I think, is the doctor or the clinic discussing about the failures. What do they do in the cases of failure? And never go for a clinic transplant where they are giving you ironclad guarantees or giving you some 25-year guarantee. This is all absolutely wrong and unethical, and this is not like that. As we have discussed, there is no 100% guarantees for any
So
medical
after all,
procedure.
hair transplant is also a kind of surgery. It's a procedure done over human beings. So there are chances of not so good a result or wonderful result. So we always have to see the result.
Also, yeah, and apart from that, please do discuss the involvement of the doctor. So we are now hearing that the doctor was there for just 5 minutes drew the line or something, and then that was never to be seen during the procedure. So the doctor's involvement has to be there for a fairly good amount of time, rather than for a few minutes and then they are just off.
So we have to see for the ghost surgeries, like
Yes, exactly.
the doctor was absent, somebody did the procedure, the patient never knew who did the procedure.
Absolutely.
So fight the fight on behalf of ISHRS and focus on behalf of AHRS. These are the two focus we have to fight the ghost surgeries. The doctor has to be there and he has to be in charge of your procedure.
Yes. Apart from that, transparency. How transparent the clinic is about the number of grafts. Did they show you the number of grafts on any counter, or they asked you to believe on what they said? So because the costing of the hair transplant goes per graft. Exactly. So these kind of transparencies. And the last important this thing is to check out the facility, what kind of accreditation is the facility, and the team. If they are hiring a team on a day-to-day basis, that means the team is not involved in upgrading their skills.
This is so true.
Yeah. So a consistent, long-lasting team and doing follow-up for you after the procedure. These are the kind of things which you should look out.
Hand-holding after the procedure. The patient should be, they should be relaxed. They should know that there are people to take care. They have the phone numbers they can call anytime after the procedure.
And do not go with a single clinic. Reach out to a couple of 3, 4, 5 clinics, and then at the end, if you have checked out all these boxes, then in the end you have to go with the instinct. Whatever you feel is the best option for you, then accordingly you should go with the hair transplant with that clinic.
That is so wonderful, so detailed. Now we come to a very important question which everybody asks. Doctor, how much would it cost me? What is the cost of hair transplant? So how do you go about this question?
So the cost of hair transplant would vary, like in our country, India or US or UK and other countries. There is a lot of variation in the price. We have seen that in US there may be a price range from $2 to $10, and in UK from £1 to £5. In India from 10 to 400 rupees. It depends on the seniority of the doctor, their experience, how often they are keeping themselves updated and going to the various conferences, what kind of planning they are doing, what kind of equipments they are using, what kind of track record they have. And mostly it depends on a multiple number of factors. So it's virtually impossible for us to give a single figure, because that would not fit many of the clinics. But I would say a medium range clinic giving good results, but at the same time discussing all your points about your hair transplant, being very open about everything. I think that's the clinic for you to decide about, rather than the cost.
There are so many factors which decide the cost, and we have to look how many factors are there which decide the cost of hair transplant. So there cannot be a single answer to it. Right. So for a detailed discussion of cost of hair transplant, you can click on the link above so that you have a better idea, a detailed idea of what all to think about. Our next podcast would be on minoxidil, which is a US FDA approved solution for male and female pattern hair loss. Do subscribe to this channel and click the bell icon so that you get notified for that. If you want to see more of hair transplant results from Saraswat Hospital, click on the link on the left. And if you want to see side effects of hair transplant, click the link on the right of the screen.